let's chat to Danny Chambers now, who's the Lib Dem MP for Winchester. Morning, Danny.
Morning, Rick.
Morning. I mean, this is a really tough one, this, isn't it? Because unlike the NHS care that we get, social care is not free at the point of use, but we're all living longer. It's costing much, much more money. What would the Liberal Democrats like to do with adult social care?
Yeah, it's a really tough subject to talk about because no one likes thinking about the fact they might need care themselves. And, 1 in 7 of us will need care later on in our lifetime that could add up to over £100,000. So it's a hugely significant issue. And certainly my family have got experience with this. We cared for my father with dementia at home for many years. And that's a really common story. I meet people every single day who are carers. And some of them don't even recognise themselves as carers. They're just a wife, a husband, a daughter, but they're doing unpaid care work. And so one thing we desperately need to happen is that to have a social care service that supports these unpaid carers, because they're contributing a huge amount to the economy. Sometimes they're taking, pay cuts themselves or not working themselves to provide this social care. And we need to make sure that they have support like respite care so that, when they're struggling, they can have a break and then continue to provide the care for that person. Because if they don't, that person ends up needing to be cared for by the state. And it's at the moment, people are really, really struggling to provide care as unpaid carers.
Yeah, I mean, I've just been talking to Vicky Slade about this as well, your colleague, and I was sharing her the story of my mum who was looking after my nan. She had to leave her job and she had a pension. She was told she would lose her pension if she had any financial help. There was no respite as well. And you think, actually, there's no information out there as well about what to do when this happens. Do you think we have an NHS, a National Health Service? Do you think there could be something separate, like a national care service as well?
Well, that's something the Lib Dems have been calling for a long time. What we've really wanted are serious cross-party talks so that we can have a costed and viable solution for social care that won't change depending on which party happens to win the next general election. Because like the NHS, this needs a long-term solution that won't change when there's a change of government. And the fact that we've had 22 reports into social care since 1997, I think it is, and none of them have been enacted, is because we haven't had any cross-party agreement. So that's what we need, a serious conversations cross-party and a serious conversation with the public about what we want social care to look like. What I would say as well is that it's not all about cost, because there's a huge amount of savings that can be made as well if we get social care right. And, I'll give you an example. Of Winchester Hospital at any given time, there's about 160 people, nearly 1 in 5 patients, who are stuck in a hospital bed because there isn't a social care package available for them. And yet that means that it affects the flow through the hospital. It means that because someone's taking a hospital bed up, that elective surgeries are cancelled or rearranged. It means that there's longer queues in A&E. But it also means, from a financial point of view, those people are costing £850 a night to keep them in a hospital bed, and yet it costs a fraction of that to give them a social care package. So when we talk about the NHS and how we make the NHS work better and how we fund it better and how we reform it, we cannot fix the NHS without fixing social care, because that's one of the main drains on NHS finances. So if we sorted out social care, it would actually make the hospitals work better, it'd be better for the patients, and it would save the taxpayer a lot of cost as well.
So what you're thinking then, Danny, is that we wouldn't necessarily, because it's about affordability, isn't it? Would we need to increase taxes? Would there need to be a special tax for social care? Or is it something we could already afford just by jiggling things around, making savings here, not spending so much money over there? Because, of course, defence, they want more money as well. You're saying that the money is there if we put it into the right areas?
Well, there's a mixture of ways that this could be brought together, which is why these cross-party talks are so important. And the red lines that the Lib Dems have got is that everyone should have personal care when they need it, and no one should suffer as a family any sort of catastrophic costs where they end up losing their house or all their savings, because it needs to be fair for the people who are receiving the care and need the care. It needs to be fair for the families that are looking after them, and it needs to be fair for the taxpayer as well. But there's a whole load of ways that we can, raise money, like, windfall taxes on the big banks, on the social media companies that are, based mainly abroad, but making a lot of profit here in the UK, and also like these reforms that would save the NHS billions, which is money we could be putting into social care instead of wasting it ineffectively on hospital beds where people aren't taking up a space where they don't need to be there.
Just quickly, Danny, before I let you go, one of the papers today has the headline, "Burnham has the best chance to fix social care, so he must not bottle it." Do you think by asking the Lib Dems and the Conservatives in that he won't?
We're going to hold him to account on this. I mean, this has been our absolute passion. For many years, we've been calling for cross-party talks on social care. We're really pleased to see a Prime Minister genuinely take this seriously. Ed Davies, a carer himself, he's got personal experience of this. It's one of his absolute passions as well. We need to make sure that no party acts in short-term self-interests and ends up sabotaging these talks. This has got to be apolitical. It's above politics. It's about fixing one of the biggest crises facing our country. It affects even local government funding. It affects the function of the NHS. This is too big and too important to be made party political. So we need to make sure everyone gets around that table, works together really hard, and comes up with a solution that the public want and need.
Oh, good to speak to you, Danny. Thank you for coming on. Appreciate that. Danny Chambers there, the Lib Dem MP for Winchester, on adult social care, what the Lib Dems would like to see, what they would like to do. We have also tried to hear from some of our local Conservative MPs, but either they were unavailable or they haven't got back to us. But if we do, we will get one on later today here on BBC Radio Solent.